We will start recording the session now. Thank you. Hello, people of tomorrow. Welcome to the first series of Global Health Training. My name is Wilson. I'm from Amsterdam, Hong Kong, and I'll be the master of ceremony for today. I am absolutely thrilled to welcome all of you, medical students joining us from all over the world: Australia, India, Japan, Pakistan, Philippines, Malaysia, Indonesia, Hong Kong, Thailand, Singapore, and many others. Welcome. Welcome to day 2 of our first Global Health Training for 23-24, the Evidence-Based Policy Writing Workshop, where we'll have an opportunity to learn about creating health-related policies. Joining us today are executive committees, regional chairpersons, representatives from each other's chapter's national executive board, members from each chapter of AMSA International, and of course, the lovely organizing committee for this training who have worked hard to put this together for you. Now, before we begin, let's watch a short promotional video from AMSA International. I would like to request everyone to turn off the camera to reduce the bandwidth for the video to be played smoothly. Thank you.
The Asian Medical Students Association is a peak representative organization of medical students from numerous nations across the Asia-Pacific and beyond, with its physical secretariat set in Taichung, Taiwan. Founded in 1985, AMSA International has been a non-profit, non-governmental, dynamic organization led by a board of medical students across the globe, bringing together chapters with a directive vision: knowledge, action, and friendship. AMSA International has functioned to promote the interest and welfare of Asian medical students through our knowledge-rich academic subsidiary, our very own academic journal, a robust transcontinental exchange program, our biannual conferences EAMC and AMC, our global health subsidiary, and our quarterly published e-newsletter. Our subsidiary set out to nurture humanitarian values and medical ethics through a myriad of strategic partnerships. Every year, AMSA International brings together over 500,000 medical students through our activities, cultivating a vibrant international melting pot of ideas and adversities. Our alumni club, known as AMSAC, connects our vast network of alumni, continuing to support them on their journey towards becoming the doctors of tomorrow. To find out more, please visit our website or follow us on our social media.
I hope you all enjoyed the video. Please turn your cameras back on and let's begin with the program today. I'll be going through the agenda for the day. So at 2:45, there will be a 15-minute icebreaker. And at 3, there will be our session 2 for writing health policy recommendations to words with our guest speaker. And then at 3:40, there will be questions and answers. 3:50 will be awarding the certificate to the speaker. At 4 o'clock, there will be a breakout room session. 4:45 will be coming back to the main room to present, and then starting from 6:48 we'll be presenting our food policy, and then 5:33 will be our feedback from our DOGH, and then finally 5:40 will be announcement of the best contributors to the policy writing. And then to end the workshop, 5:45 there'll be feedback from and picture taking for all of us. Next slide, please. For the highlight of the day, we will have a workshop session with a prestigious speaker. You might want to prepare your questions now for the Q&A session later, as this might be a once-in-a-lifetime opportunity. After that, we'll be having a breakout room session for finalizing evidence-based policy making that we have created so far. So, before we start, can you kindly name yourself as your group number, your name, and your AMSA chapter? Thank you. So we will now proceed to our next agenda of the day. I would like to invite Sydney Jandra as our Director of Global Health. The screen is yours. Thank you, Sydney.
Thank you very much, Wiston, for the opening. Greetings, people of tomorrow. Hello again. I'm Sydney, Director of Global Health for AMSA International and this tenure. It's truly a pleasure again to see how all groups have progressed into respective groups' policy documents, collaborating in writing a policy recommendation product. I truly hope that the previous session, the webinar session together with WHO EVIPNet, has helped you with the knowledge needed to finalize the policy document. Today's session entails a speaker from GISDI, Ms. Diah Saminarsih, which is an Indonesian policy think tank that I'm sure will provide various practical insights for all of you. And we will also be having a breakout room session in which you can hopefully gain knowledge, action, friendship together with your group's peers. I am excited for today as it is the last agenda for Global Health Training 1. And I look forward to your active participation as well when we open the recruitments for AMSA International Policy Working Group. Looking forward to your active participation in today's session. Thank you, everyone. FIFA AMSA.
Thank you for your speech. Thank you for your speech. Next, I would like to invite Vicky Chang as our Vice Overall Chairperson External.
Thank you, Winston, and good. Hello, everyone. This is Vicky from AMSA Taiwan, and currently the Vice Overall Chairperson External for AMSA International. And good to see you all again here online. And I believe that everybody must have learned a lot and have been inspired from our webinar during a Friday session. And I believe in today's webinar with Mrs. Diah's speech and sharing on evidence-based health policy writing, and with your discussions with your fellow group members on your policy documents writing, you will hope that everybody will learn a lot from this. And also greatly a big thanks to all the GHOCs and GMs and Sydney, and also our Global Health Subcommittee members for their contributions to making the global health training come true. And looking forward to see you all in our future activities and global health trainings and our policy document work group. Okay, so I won't be saying too much and hope you all have enjoy your day today. Viva AMSA.
Thank you, Vicky. Now I would like to invite Sheng Yu as our overall chairperson. Okay, I guess we'll wait a minute for Sheng Yu to join our Zoom. Okay, now may I invite Sheng Yu as our overall chairperson for his speech. Thank you.
Okay, so thank you so much, everyone. So, I'm sorry for not being able to make it a few days back, as I was having some issues I have to deal with. So, how is everyone doing? I hope that everyone has enjoyed your time for your global health training. So, yep. So actually, without further ado, I actually like to congratulate Sydney as well as Vicky for being managing such a wonderful global health training. And I hope that you guys have actually learned a lot through the global health training recently, where you guys are actually taught on how to use evidence-based papers to actually develop a global health policies, which is something that AMSA International is looking forward to. And I will actually like to see what policies that you guys have actually drafted or any policy suggestion that you guys have, and hopefully that we'll be able to equip it into our AMSA International, and perhaps we'll come out with our own policy booklet. So do stay tuned for a lot more activities from Sydney as the Director of Global Health. And I will actually end my talk here. So I hope that you guys have a nice time. And okay, so people of tomorrow, brothers, sisters of AMSA, Viva AMSA. Thank you so much.
Thank you for your speech, Xiangyu. Now may I invite Ayesha for the icebreaking session?
Hello, everyone. My name is Aisha. I'm from AMSA, Pakistan. I apologize for the lack of background on my Zoom background because it just was not adjusting to, I think, like the light intensity. So I apologize for that. But I'm really excited to be conducting this icebreaker activity and kind of have like a fun little activity before we get to like the work portion of this. So our icebreaker activity today is going to be titled Give Me, and I'd like to proceed to the next slide so I could like give you a bit more information. All right, so for the instructions, an item will be flashed on the screen on like this presentation, and participants will be told to acquire as much of this item as they can. Once you've acquired this item, you can type in the message box via AMSA, and you'll be acknowledged by me, and then you can unmute your microphone and turn on your video to show the item. And then also when you're doing that, you're going to be asked to introduce yourself, whether you have a nickname, your AMSA chapter, and what you're most looking forward to for today's session. So I hope you guys enjoy, and we are going to be proceeding. So just get ready, get active, be more aware of your surroundings, because we're going to start in 3, 2, 1. All right, next slide. Pen. All right, you guys just have to message Viva AMSA when you feel like you've acquired enough of it, just like a small reminder. Hi to everyone joining. All right, Viva AMSA. All right, could I see how many pens we have here? You could unmute yourself and just introduce yourself now.
Okay, thank you for the opportunity. Hi everyone, I'm Deborah, or you can call me Debbie, and here I have quite a lot of pens. 1, 2, 3, 4, 5, 6, 7.
All right, you can proceed to tell us your name, your nickname, your chapter, and what you most look forward to in this training.
Okay, hi everyone. I'm Deborah, and you can call me Debbie. I'm looking forward for this GHT to learn more about the policy and how we can make some writings. Okay, thank you. Oh yeah, I'm from AMSA Indonesia.
All right, perfect. And while we were doing this activity, we were also joined by Mrs. Diah, and we really wanted to thank her for her willingness in becoming our speaker for today's training. Thank you so, so much. All right, so we're just going to be proceeding with one more, and then we're going to be heading back to the session. All right, tumbler/water bottle. All right. Do we have anyone else besides Deborah? Thank you again for being so proactive once more. Thank you. Is there anyone else that would like to take the floor? All right, Deborah, I think you're just going to be the winner of round 2 as well. So congratulations. I don't see any Viva Amps in the chat. So 2 for 2. Congratulations. All right. Well, then this concludes our ice-breaking activity from my side.
Hello, everyone. Allow me to introduce myself first. So I'm Florence from AMSA Hong Kong, and I'll be guiding you guys through our workshop session. So now I would like to introduce our guest speaker of the day, Ms. Diah Saminarsih. She is an Indonesian development practitioner and public health advocate, currently serving as the chair of the board of trustees and CEO of Public Health Nonprofit Center for Indonesia Strategic Development Initiatives. She is also a psychologist by academic training. Her professional journey has gone across consulting companies, government, and national public institutions and multilateral organizations. She has many publications, especially regarding public health policies, which aligns with what we are doing right now, the evidence-based policy writing. So let us welcome Ms. Diah Saminarsih.
Hi, everyone. Good afternoon. I think it's all good afternoon in one time zone, I guess, or early evening, perhaps. Nice to be here with everyone.
Thank you so much for coming and agreeing to give a talk in our global health training. So before we begin, I would like to once again remind everyone that we will be opening the floor to the audience later after the talk. And if you have any questions for our guest speaker, you may also type your questions in the Zoom chat feature. So Ms. Diah, the floor is yours.
Okay, I will try to share my screen. One moment. This one is. Okay, I hope everyone can see the slides. Okay, so hi again, I'm Diah Saminarsih. I'm founder and CEO of CISDI. It's a health based institution, civil society organization / think tank in Indonesia, specializing in health sector alone, health and development, and also the sustainable development goals. And we are entering our 10th year next year, so this is our 9th. We have a couple of or a few other initiatives that you might perhaps heard of, the Pencerahan Nusantara, and also Puspa in West Java, PN Prima also in West Java, and several others that is on health system and primary healthcare strengthening. And also we are doing advocacy, policy advocacy in numerous campaign and advocacy in numerous issues, most notably the tobacco control, nutrition, food policy, and also in global health. Okay, so I'm going to, since we are diving down into the topic, usually I give the context first, and then I will go down to the technicality. But I would like to switch this time by hitting the technical points, and then we are going to then discuss or evolve generate ideas on how do we bring all of this technical know-how into a story? Because yes, policy advocacy is basically telling a story, but it's a story that's based on evidence. First one, of course, is what is our vision? What do we want to change? What change would we like to see? And setting the priorities and visions, we can do a virtual meeting like this. This is an example from a digital health initiative that I'm a part of with WHO. And it starts from transforming health systems and what tool or what entry points are available out there which cross-cut health system functions. So, and we can focus only not addressing the disease, but also in prevention and well-being. Social and well-being in health. I mean, these are all basically areas in which you can focus your evidence generation on, or you can focus your research in. Sadly, in Indonesia, we do not have enough evidence generated through either research or action research, if we do it in public health and we intervene right on the location, right on the communities. Sometimes from civil society or research institutions do not have a sizable sample where then it can be herded or being swiped into the evidence generation mechanism. But however, I think we should look at what areas are in attacking health directly and what is outside of the health, but also interconnected with health. Environment is one, housing, neighborhood is the other. So we can talk about poverty and also talk about health. We talk about social norms, discrimination, racism, gender disparity, gender inequality. We can talk about food system. So there is a health system, there is a food system. We can talk about healthy food, what makes a good food system, and also then link our topics and ideas with the health system. So what I just mentioned links directly to health in all policy. This is the universe, the multiple universe of health, because health is interlinked with other sectors, and it's not only about health services provision, or it's not about making sure there is an accessible and quality health system, but also we would like to see other supporting actions to health. For example, what's your diet? How do you do your daily intake? Do you have any addiction? How is your coping mechanism on mental health? Do you exercise regularly? What type of transportation you are in? And this is also, if we take a look of each topic and see evidence within this each topic, we will find the interlink to health. So when you try to look for evidence in health that have a relation with health, you do not need to always look at the health system, for example. You can look at social economic factor and still find a linkage to health, and you can still be able to then write your story or write your research and then your story about social health and social economic model. This is very, this is the discrete domains of evidence. And these on the left side here, you can see who made the research about what, the study design, study execution, consistency, measure of the precision. These are all the domains of evidence. And you can see also coherence is one of the areas where evidence can be measured. So if an evidence, if you find an evidence that is not coherent, then that evidence might not be a strong one. Then we see a look at the challenges. We determine our vision, we know the technicalities, then we look at the challenges. This is the digital health. Again, this is an example I take is digital health. Why? Because it cuts across health system. And when you talk about digital health, you can also talk about its relation in poverty, its relation in social economic setting, and also geographic tool. And also you can, because this is a new and up and coming area, you can also look at the funding. In health system challenges, we then determine what's the research question. After vision, technicality, we know what type of evidence will be regarded as good and strong evidence. Then we also have to see the research question. Research question typically are priorities that you think are important. But if you say, okay, I have 15 priority areas that I want to be answered, then you might want to ask yourself again whether it is actually a priority or not. Because usually a priority is between 3 to 5 top priorities. So if you have one research question and then you have 3 to 5 underneath that top research question, then that should be a good number of research questions that you would like to be answered in your paper. Of course, then you have to determine what methodology, what framework you would like to work in. There are references in many research articles, in many scientific journal or publication, where a framework can be used. And then if you would like to propose a new framework, that framework can be adapted from that reference that you use. But it is very important to structure your story. So if you write a paper, actually you are writing a story. You are saying, oh, this is my vision. This is the tool I want to use. This is the framework where I will base my research on. And these are my research questions or top priority areas that I will need answer to. So research topic also need prioritization, but also it needs to reflect, to have further reflection and deliberation. So it's not straightforward, like you are answering, writing your test, for example. It needs your analysis and it needs your reflection and deliberation. This is the tricky part, because then you have to connect different references that you have read to then build a story, build a convincing story where you can then present your evidence. What is the collaboration between researchers and policymakers? So as researchers, we think, okay, we write our research, we generate the evidence, we use the methodology, we use the framework, we write our story, and we are done. Sadly, that is not the case. So we should raise the bar that as researcher, it's not only important to complete and have really a robust, deep answer into your research questions, but it's also important that your research make impact. And how do we make impact? You go to two. You go to civil society, where you can then ask, let's team up with together, because I have this, the research that I have done, and I would like to implement that in certain location. Or you go to policymakers. Typically, this is the match. This is the relation between policy and researcher. So research, generate the evidence, write the story, write the policy paper, and then present it to the policymaker, and policymakers say, okay, let's make this research, make this evidence into a policy. As a policymaker, if you are a policymaker, then it is very important to know whether you have worked directly with the researcher. So 1 says no, 3 says yes. As a researcher, have you ever worked directly with a policymaker? Lately, this number has grown. So this is from a group of 13 consultation participants, and 9 says, okay, 6 says we have worked with the policymaker, 1 we don't know, and 2 we haven't. So this is very important that researchers understand from the get-go that your research will be better if it can reach impact, if it can change people's life. And how do we do that? Then you go in a smaller scale to a civil society organization or a network of civil society organization and implement that research directly to generate a stronger evidence, and then give to policymaker, or you take your research directly to policymaker and then advocate for it. Evidence of health system decision maker, typically the learning cycle is like this: help understand problems and potential solution. Evidence help adapt and adjust regular action. So in where do you want to be? Or where would you like the policymaker to be at? Evidence can help compare and test alternative strategy and readiness for implementation, or evidence on the performance of existing strategies. So you can review what is already ongoing, or you can present new evidence and say, if you implement this, policymaker, if you put this as one of your policy, then it will generate bigger impact, and then help compare, test alternative strategies, and it will be ready for implementation. Okay, this is the, I'm sorry, the picture is not so good, but this is, this tells the story of engagement in planning for research, implementation, and dissemination. So you plan your research, and then you write it, you implement it, you advocate to policymaker, and then together with the policymaker, you use the dissemination. And you need engagement in monitoring, you need engagement in assessing, and then you interpret or analyze change and impact, and then make the learning as base for the next policy. And then you choose the design and the execution strategies. So this is the usual cycle or process that typically researchers use. And now let's reflect. What is your experience in terms of research and evidence-informed policy? What are the most significant enabler and barrier for engaging policymaker in using research to inform policy and practice? Perhaps you will think now, oh, I'm still in school. I only need to learn the technicalities. I don't need to engage policymaker in using research as information of policymaking. I beg to differ on that argument, because I think the earlier as students in public health or medical schools, the earlier you engage policymakers, the earlier you understand how they think, the earlier you can influence your scientific thinking and your methodological thinking into their policymaking. That will be better for both. So both you and the policymaker will gain from that interaction. And then you can answer these questions. What worked well, what didn't, what could be improved. So when you are then, if you have, now you start writing paper, perhaps as part of your class assignment. But actually it will be good if you start following up or building up on those papers that you have written, and see how you escalate the quality of the story, how you escalate the quality of the data, how then you communicate your research to people outside of your regular network. Now I would like to ask us to look at the context. Okay, so what I just said are the technical know-how of a researcher. But when you are writing your paper, then you will have to know the context, which is also very important. Where do you stand in this? Are you for equity, because of health is for equity and human rights? Are you for your positioning as you as you embark on your research? Are you going to tackle the smaller number of people who live in urban setting, the smaller number of people who have privilege, or are you going big into equity and you say, okay, my research is going to stand on the 40% of the population who needs more help from a good policy in public health or a good policy in medicine. And then this is the equity part, and this is part of touching upon slightly on my point about the social determinant of health. That actually this is the electricity grid of PLN, of the Indonesia's electricity coverage, and only Java has electricity mostly 24 hours. Outside of Java, it's not 24 hours. A lot of areas are still not 24 hours. So how are you going to link this social context into your research in health? So that is part of the context where we work in, we as in CISDI. Against that backdrop, we have put out our vision. Remember what I said earlier in the presentation a few minutes ago. Put our vision. We put our we seek evidence, and when we don't find enough evidence, we generate, and then that evidence becomes the answer to our research questions in primary healthcare setting. So this is all based. So what you follow, if you follow us on social media, if you see CISDI anywhere in the website, then that is a story that we are able to tell only because we answer research questions on primary healthcare strengthening and reform. And then we decide to tell our story at Puskesmas level or primary healthcare level. And also we decided to tell our story with the community health workers. So whatever we package as a story in the public sphere, actually there is a researcher head very strong controlling it. And then after all of that, we then present the findings to the government. And then they can safely say, okay, now we are transforming our health system and we are reforming our primary healthcare. So this is the type of evidence that we generate from the community, which is available for the public. And you can see that in the dashboard. It's available in CISDI's website. We do population mapping, analytics, and data integration. And this is based on evidence we generate from community health workers in, I believe, 21 locations throughout West Java. So this is where then from this data, a story can be told and then a policy brief can be written. So this is the 360 loop of evidence, bringing evidence into policy writing. And we can use it not only for policy, but also for us, the public, handheld. We can also use it for the benefit of the health workers and the community health workers. So it is basically everywhere, but it will be good if, as a civil society, CISDI then present all of this to the policymaker, and then they uptake that into their own policy, like what they are doing now with the transformative pillars of the Ministry of Health. That's it from me. I will end there, and I would be very happy to answer your questions, if any. Thank you.
Thank you so much for your sharing. So now we will be opening up the Q&A session for all the participants. And if you have any questions for our guest speaker, you may either type your questions in a Zoom chat feature or raise your hand if you would like to voice out your question. So I can see that there is one question in the Zoom feature from Abbas from AMSA, Pakistan. So the question is, how do you identify the problem and whether policymakers are interested in it?
Thank you for the question. So it depends on there are so many methodology that you can use. CISDI typically use a foresight approach where we map out the future of Indonesia health sector development. That is done through horizon scanning, that is done through consultations with experts, and then we determine what are the key areas or key priorities that that are needed for Indonesia's in the future. And then we started to do smaller scale action research on the ground, and then do impact evaluation, and then present that impact evaluation to the government, the policymaker, and then they uptake the recommendation.
Thank you. So we have another question. So from your experience as a consultant, are there any contexts or conditions where you have encountered that evidence is not the answer and practical heuristics are more applicable for beneficial policies rather than evidence?
So far, no, because we would like to influence evidence-informed policymaking. So we try to always start from evidence. We never, well, perhaps if we are, if the pilots have flying hours, right? And if I'm being asked about my sense in something, then that's fine. My sense meaning I can go back to my own tacit knowledge and say, okay, based from my own experience of 20-something years, typically this happened. But it's my opinion as an expert. And if you go to the grading of evidence, that opinion of an expert is the lowest score, has the lowest score in evidence. We typically stay away from that because there is quite large subjectivity. We would always like to have evidence, be it from our own country or regional in context or global in context, at least the best practice, or at least something that has been written on paper, published in a peer-reviewed paper somewhere. Then we try to find that, and then we feel better if we say, okay, based from our desk review, this is what we found. This is what we found based on the journals and something like that. But if I'm being asked as an expert, then I will say, okay, this is my own tacit knowledge, me speaking as an expert of 20-something years, but not, I do not want to make that a habit, and I will always ask, if I'm being asked as an expert, I always ask to, for the researchers to please do your desk review and do your consultation, and then challenge my opinion with whatever you found scientifically.
Thank you. And a follow-up question to that. So you have mentioned about deliberation and not merely writing. So could you please give us an example or a case of how you combine multiple evidences?
Yes, of course, there is always, it's nice and very interesting as a researcher if you found multiple evidence, because then you found two that say that supports you and one that does not support your idea. Typically what we do is we state the fact, and we just say, okay, this is our proposed framework or our proposed approach, and then we go back to see the evidence, and evidence point us towards two different directions. Such and such say the evidence is this, which then supports our framework, but there is also competing opinion saying that which does not support our proposed framework. So then we go back to our expert opinion on, we invite 10 or 20 experts to challenge this idea, and this is what they found. So it's basically telling, just telling what you have, and in a very comprehensive paper, in a very comprehensive story.
Thank you. So our next question is, do you have examples of published policy papers from your organization? And do you have tailored policy paper types when trying to advocate for different stakeholders?
Yes, there are many. You can go to, I will type here in the chat box. You can go to CISDI.org. Then you can go to the publication, and you can see the publication tab, and you can see all the papers that we have published. The latest one will come up soon. We are published in the British Medical Journal on using this course, network analysis in food policy. So it will be included in the WHO and BMJ paper, the magazine. It will come soon.
Thank you. And then the next question is, would you please elaborate on various types of health policy recommendation documents and how we as writers should keep that in mind, such as variation in length, variation in object, and variation in targeted stakeholder?
There are so many. I typically would like to, it depends on the issue. I would like to take the recent Indonesia health bill as an example. That one moved very quick. It was a fast-moving consultation, fast-moving dynamics. There are so many competing arguments for it and against it. So we do not have enough time to, we did not have enough time to generate real evidence. So we go into our network of coalition advocacy. And then we then share experiences and write multiple but short papers. That's typically we call that policy briefs. So it's basically, let's say, under the health bill, we write something about the mandatory spending, the deletion of mandatory spending in the Indonesia health bill. Short, 2-pager. And then we write again about tobacco control, information, advertising, promotion, and sponsorship. And then we write again. So there are so many that we wrote just under the same topic of health bill. Or a longer one. CISDI produced an outlook document. So it's a book, actually, that we publish every year, saying, okay, this is the evidence, this is the learning we have from last year, this is the trend in which we see Indonesia is going. We employ certain methodology on it, and then we recommend to take this and that as a priority, ABC as priorities. That's what we call policy paper. There is also chance of, in the G20 last year, one of our policy officer, and I think it was 2 or 3 of the policy team members, wrote an article, and that got through to the T20 publication. That's also policy brief. The longest one that and also we write scientific papers like the one we use the one we send to British Medical Journal, the Lancet opinion commentary pieces. There are a few already out there. And also we write research paper. We write also the longest one will be published next, God willing, next month, exactly a month from now, minus 1 day, which will then be, so on the 13th of November, it will no longer be a policy brief or policy paper or advocacy paper or scientific paper, but it will be a white paper. So a white paper actually is written to shift or change policy and change priority, reset the agenda for the next one. And this we will publish one big book and plus one executive summary and 12 other briefs, thematic. So in total, there will be 13 to 14 books that we will publish at the same time. So this will be the biggest series that CISDI will write as a team. So that's the different ways where we can tell a story. But there is also one more thing that is no less important than all those scientific big papers, is a story. We can do it in a medium of movie, but also based on evidence. There is a documentary that we produce on the community health worker and also on the tobacco control, tobacco farmers. And we tell also a story in books. So after the pandemic, as a person going through, at that time I was still in WHO, going through the unfolding of the first days of the pandemic, I tell my story as me, as Diah, as an expert in WHO. That is also a story there. So it's different writing style, but also no less, it's as powerful as any other scientific paper that we might have written.
And we have a follow-up question. So when is it better to write 1 to 4 pages of policy briefs, and when is it better to write longer policy analysis or reports?
When you have more time, you spend time and you plan it. I mean, we plan the white paper, this upcoming series that we are going to publish. We planned it since last year, since exactly a year ago today. If you have time to plan, then you do it the long one. But if you are advocating an issue like what I just mentioned about, an urgent issue like the health bill or the bill for sexual and reproductive health that just went on in last year and also this year, you didn't have time, then you write a short one. And then that's only basically based on desk review and also sharing of expertise and sharing of best practices between organizations in the coalition.
Thank you. So we have a question from Ivan from AMSA Hong Kong. So how can medical students get involved with healthcare, think tanks, and policy making?
All you have to do is ask, actually. Write us an email. And not only CISDI, there are so many in your end of the woods or in my end of the woods. There are so many who works in communities, who works in policy advocacy, who works on certain issues or work in a health system like CISDI does. And I have never heard of well, if you reach out to WHO, for example, they have bureaucracy and they have rigid rules. But if you reach out to civil society organization, research institutes, think tanks, typically they would welcome collaboration with medical students, with public health students. So you write an email saying, I would like to collaborate. I think this is a part that I know based on my organization experience. This is the part where I know I can be of help. Are you willing to do that? I'm speaking from my own experience. One time there was this medical student 2 years ago at the beginning of pandemic who reached out to my colleague and I, and he said, I think medical doctors should have a more prominent role in policy making in Indonesia. And he came up with a draft paper and he asked, would you be interested in writing this with me? And I actually said yes. I said, oh, this is very interesting. Quoting Virchow and saying, oh, we are inspired by this doctor in Indonesia who did a revolution in Indonesia. And I said, okay, let's write the paper together. And then we sent it to the Lancet. He found contact in the Lancet and he established contact and sent it there and it got published in the Lancet. So nothing is impossible. And then we did many more papers, I think 2 or 3 more. And then at the end of his medical study, he came to me and he said, would you be willing to accept me as a part-time employee in CISDI? And I said, if you really want it, then you have to really apply for it. Why don't you write an email and send me your CV, and then I will put it into the HR mechanism and see if they can use you. And he said, okay. And he applied, and now he's part of my white paper team. So I think that's another story to tell. I hope it's something that he will tell and he will remember later as he makes his way up to become a professor of medicine or something.
That's amazing to hear. So we can move on to our next question. So would you please share practical tips in writing policy recommendations, such as what kind of words to avoid and common shortcomings in writing them? And how are these writings different from scientific journals and reviews? And for example, you have also mentioned that CISDI had wrote for BMJ as well.
Mm-hmm. Yeah, it's different when you write for BMJ. One thing you have to be prepared for is they do send very harsh comments, and you do have to revise. There is no special treatment. You do have to revise, and they do need to, we have to show rigorous methodology, and it went back and forth for how many months before they finally say yes. And there is no guarantee that after 2 or 3 revisions they will accept. They will also decline. That's scientific paper. For policy advocacy, your audience is different. Your audience is policymakers. They only want to know, okay, what do you want me to do? What are you trying to, what point you are trying to prove to me? So you cannot be too long. You have to present, but also you have to present that paper, fill that paper up with enough evidence, shows that you have done your research, and then structure the language into a language which is easily digestible to policymaker. When you write your paper, like the health outlook that CISDI writes, or like this upcoming white paper, then you are actually, I feel like when I'm writing it, I'm actually in between. So I do have to be scientifically sound, but I also know that the readers, the audience, my audience will be policymakers, private sector, the general public, students, the media, the political parties, and so on. So it depends on one, who your audience is. But all the commonalities throughout these different types of papers, one commonality that we always use and we obey diligently is that we have to have a framework, we have to have a methodology. So I present with the proposed framework, then we do this methodology, and we come up with this framework. I think that pattern needs to be there. So you have to have robust methodology because you want your paper to work or to be accepted in the scientific community. You want that to be accepted in the policy community, thus you need best practices and references, and you want that to be accepted in general public, civil society, the media, the private sector, students and youth. Thus your language needs to be chewable. It has to have certain buzzwords that you have to have there. And all of the books in health policy or public health, I have identified that they use certain language, use certain terminology. So you use those terminology and you avoid others. Like, for example, if I say business process, that is something that I introduced in the development sector or in the health sector from what I learned in my experience as a management consultant. And then I find out that it works in both. But when I use the word lobbying, I cannot use it in my paper to the government because it has negative connotation as opposed to advocacy. And how do you find out? I don't know this 10 years ago. I only learned when I started writing a policy paper 10, 12 years ago, and then I know what to avoid, what to use better instinctively, and you know that is the language your colleagues will accept.
Thank you for the advice, and I'm sure all the participants can use your advice in doing their group projects later on. So our next question is, for health bills, it's quite straightforward that the stakeholder we should target is the Ministry of Health and legislatives at the national level. Since AMSA International is an international organization, what type of organizations do you think are strategic for us to target?
Okay. One, of course, you need to work very closely, or you need to know at least the context in your own country. because that is the trend in global health right now. You are not going anywhere in global health if you do not have strong footing in your national health system. So the top priority will be for you to know what's going on in your country. You cannot say much if you don't know. And people like me, when I sit in a panel and I interview young people, I always know when they know, and I always know when they make it up. So you have to know your lay of the land. Organization-wise, then will be at national level is the MOH, and then if you are in a federal country with federal government, then the regional and also the provincial, and also at regional level you engage with WHO, of course. Different regional, you have different WHO office. It depends on where you are. But don't forget that even WHO now has the Civil Society Commission. So it's very important that you engage with your civil society who has national outreach, but also civil society that has regional and global outreach. That way, you see that your work is going to be anchored to them. Another point that I would like to make, since the pandemic, but in textbook I've read that it has begun in the 1950s and 1980s in developed countries. The role of civil society has increased. So it's very important also for you to engage with civil society organization. So civil society, universities, WHO, international organization, UNICEF, economic institutions like the World Bank. It's also good if you can be part of projects that they give grants to. And I would like to answer this question in the chat. Behavioral economics and public health are like brother and sister, so it's in the same family. Right now, there are so many ways where we can say, oh yeah, it's very important to do behavioral economics, because then you do, once you know, then you design policy based on incentive and disincentive, and you know what will make the population change their perspective, what will trigger the public to do something to operationalize a policy, and you will know what will make them not do anything. That is the beauty of behavioral economics, and you will also be able to touch on the political economy of your own country when you understand behavioral economics, and it then will influence how your country do their budgeting for health.
Thank you. So now we will be asking our last question due to time constraints. So the question is, CISDI's documents have always been beautiful with its well-thought graphics and diagrams. How important are visuals in evidence-informed policy contributions, and would you share more about that?
Oh, very important, very important. But the reason you say that it's very beautiful and with informative graphics is because we provide those numbers, those data to our colleague who works in communications, so they can make it into a beautiful setting, graphic, video, motion graphic, whatever. And also on paper. But the first term, the first condition to that is you give them the correct data, and that is the work of the researcher. In CISDI, the team in communications and team in digital development are equally big. We have a big team for a program for primary healthcare, for policy, for research, for tobacco control activity. We have a big team, but we also have a sizable team in graphics, in communication, and also in digital development. So every single thing is important. One cannot work without the other. And I would like to say you will not say that it's beautiful and very eye-catching if the data is wrong. I can say that wholeheartedly. I believe that's the case. So you say it's beautiful because you know it's right, and vice versa. The team who work for the data know that their data will mean something to the public. It will be packaged into something that's good because they trust their colleagues. So I think it's a dynamic that we have to work on nowadays in modern day policy making. So gone are the days where you are presented with graphics with too many words, and it's no longer work.
Thank you so much for all your answers. So I believe that will be all the questions for today, and we will have to end our Q&A session here. So thank you to all participants as well for all the wonderful and interesting questions. And thank you, Ms. Diah, for answering all of them and giving us so much advice for policy writing. But before we let you go, we would like to present an e-certificate to you as a token of our appreciation. And we would also like to take a quick picture with you. Okay. So let me put this on gallery view, and I'll take a screenshot of everyone with this. Okay. Okay, smile in 3, 2, 1. Thank you so much. So once again, thank you, Ms. Diah, for coming. Thank you for giving your sharing and your talk, and we really appreciate all the answers that you have given us.
Okay, thank you. And please stay tuned to CISDI's social media. We are going to have to host a primary healthcare forum on the 13th and 14th of November in Jakarta, and we are giving free scholarship, so free entrance to the forum for students. And I have my colleague Tessa here who you can liaise with if you are interested to attend. Okay, thank you again, and best wishes to everyone. Thank you.
Thank you. So now I'll be passing the time back to the Master of Ceremony, Wiston.
Thank you, Florence, for the amazing moderation of the workshop. I would also like to ask all of you to complete the feedback links provided by the O student chat box right now, and you can see it on the screen. You can either scan the QR code or manually enter the provided link that is visible on the screen. We believe that this feedback will be valuable for us and is essential for your certificate. It will help us improve in our next global health training. I'll give you guys a few minutes to enter this link. So our next agenda will be finalizing policy document writing sessions in the breakout rooms. You may also refer to the participant kit for further information. You will have around 45 minutes for this session, and you'll be assigned to a breakout room soon. So stay tuned.